Thanks for tuning in to the Keto Answers podcast. I am your host, Dr. Anthony Gustin, and joining me this week is Dr. Michael Ruscio. Dr. Ruscio is a good friend of mine, and he is an absolute expert at all things gut health. He has spent his entire career diving in deep to how to treat the gut, and he just recently distilled all of that into a book that's phenomenal, which we'll get into. However, he came on the show and busted every single myth that I know of about gut health. Stuff including what we do and do not know, the fact that we do not need as much fiber as we think we do, what probiotics to take, all the stuff. He is an absolute animal, and I'm so happy that he's on the show because I think that gut health is one of these things that so much misinformation is being thrown around that really confuses people, and they end up doing a lot of unnecessary things. So if you're interested in know anything gut or how it could be impacting your health, tune in. Before we get to the episode, I wanted to chat about our sponsor, Perfect Keto. Perfect Keto is all about making a ketogenic diet healthy and accessible. Whether you're reading all of our online guides or articles or enjoying Perfect Keto's exogenous ketones or any other keto-friendly products, everything you need to make keto work for you is at perfectketo.com. I know what you're thinking. Hey, aren't you the founder of Perfect Keto? Yep, that's right. And all of my insanely high standards have been put into making each and every product. My background as a functional medicine clinician helps me craft the cleanest and healthiest possible products and best information about a ketogenic diet. Head on over to perfectketo.com to learn anything you need to know about the ketogenic diet. And if you've never tried any of our products before, feel free to use the code KETOPODCAST for 20% off your first order. With that being said, let's get into the show. All right, Dr. Michael Ruscio, thanks for being on the show today, my man.
Thanks for having me.
So also kind of a similar background, but you kind of really diverted hard after school and went to functional medicine and specialized into gut health. Can you just give a little bit of a brief intro on your background?
Yeah, sure. I was in college and I was planning on going into conventional medicine, and then I ended up starting to feel really ill for no reason at 23 years old as a college student who was also playing lacrosse and was pre-med and typically had tons of energy and felt great. I was having insomnia, fatigue, brain fog, some irritability, feeling cold, feeling like my hair was thinning. So I went to a few doctors, my internist, I found an endocrinologist, got a workup there also, saw a GP. They all did their workups and said, nothing's wrong with you. You're very healthy. You're athletic. You got low body fat, good blood sugar, good cholesterol, what have you. There's nothing appears to be wrong with you. There's nothing we can do. And so I'm in a really tough situation where clearly I'm not feeling well, but there's no answers. And so it led me to find a DC who specialized in functional medicine and kind of subspecialized into gut health. And he said, I think you may have a parasite. And I remember thinking, like, this guy's nuts. I had never been to Mexico or, had your stereotypical, you're traveling outside of the country, you got food poisoning, and then all your stuff started. I had never even left the country, had never had food poisoning. But I figured, what do I have to lose? So I spent $350, and as a college student, that felt like $1 million on a stool test, and figured out that I actually had a parasitic infection. Now, the interesting thing was before I saw this doctor, I spent probably 6 months going on the internet and reading about adrenal fatigue and hypothyroidism and metal toxicity. And I totally spun my wheels doing adrenal support, thyroid conversion support, metal detox, and nothing really helped me. It was only identifying and treating that problem in the gut that led me to lasting and marked change in how I was feeling. And so I diverted my career path to go into alternative medicine, and I was always super passionate about that. I've been open to everything, but the gut was always very interesting to me. And fast forward, I've been in practice now for a number of years, and the gut work is amazing. It helps so many people. But by the same time, there's a lot of waste in functional and natural medicine. There's a lot of unnecessary testing. There's a lot of fallacies. There's a lot of unjustified fear around food. And so I've been working hard to provide people with a progressive model, but also one that's conservative and effective. And in my clinic, I help hone some of that. And we've also been working on publishing some literature. I have one paper published in a peer-reviewed medical journal, and we've got a couple others on the way. And I just recently wrote a book kind of compiling all this information, both a reflection of my years in clinical practice, plus about 3 years of direct work and just under 1,000 medical references to give people the one book that could help you with all of your gut questions, set the record straight, deprogram any erroneous beliefs, and give you a protocol for how to apply effectively and efficiently all of the available gut health treatments.
Yeah, and the book is why I wanted you to come on the show, because like me, you are very down to earth and you are just straight to the point and you don't like a lot of fluff. And this book just kind of tore apart a lot of myths that I think that float around the internet unnecessarily about gut and gut health. And so I wanted to really just kind of point in and chat about a lot of this stuff. I think that especially people who are maybe transitioning from one diet to another, they hear all this things like, you're not going to be getting enough vegetables on a ketogenic diet, for example. You're going to be reducing all your carbohydrates. Aren't you worried about fiber and stool and all this type of stuff? So maybe we could just start there as far as all the stuff that you say in your book that I think that there's a lot that a lot of people wouldn't know intuitively. And I think that the fact that fiber is somehow in our heads now as a culture as more is always better. This is something that's kind of annoyed me a lot in the last maybe 3, 4, 5 years as well. And we get these reports just constantly that more fiber is better. More fiber is better. Like you will have constipation or diarrhea or both at the same time if you do not eat a massive amount of fiber. Can you just maybe touch on why that is the way it is now and what you think as far as an opinion on it?
Well, I think as humans, we're all prone to assumptions and we're all prone to dogma. And there are certain things that are just ingrained into societal thinking. And if you don't take time, as I did, both in the book but also in reflecting on my clinical experience in my practice, to question some of these things, you can just keep reiterating and advancing a prior but erroneous dogma. And fiber is one of those. Now, the challenge is that some of the beliefs regarding fiber have been compounded by the recent boom and interest in gut health, right? The microbiota, as it's also called, the world of bacteria and other life in your gut. And as there's been this boom and interest, there is this observation that healthier people have healthier bacteria. And another observation that fiber and prebiotics feed healthy bacteria. So it's very easy to draw an inference that, okay, so a sick person, if we give them lots of fiber and prebiotics and feed their gut bacteria, they will then become healthier. It turns out that's not actually how this plays out for a fair number of people. Yes, there is data showing that increasing fiber and prebiotic intake in the diet can be helpful, but it's not helpful for everyone. And real travesty is that for people with pre-existing digestive ailments, that actually seems to more often than not be the opposite of what's true. Meaning for people with IBS or inflammatory bowel disease, there's a fair amount of documentation showing that high fiber and high prebiotic intakes can make them worse, and some impressive clinical documentation that lowering fiber or at least prebiotic contents in the diet can improve their symptoms and also reduce things like inflammatory markers and leaky gut. But the miss comes from the fact that there's these observations that oftentimes healthier people have healthier bacteria, and a huge inferential leap is made that assumes that if you feed sick people more fiber and prebiotics to help increase the population of their good bacteria, it will make them healthier. But that's not what we see when you work as a disciplined and cautious clinician or scientist. You don't draw inferences. You look at the data and you say, well, before we have humans do something, we should look at what the clinical trials show. So because we see that healthy people or hunter-gatherer bands in Africa may consume a lot of fiber and they're healthy, does that mean that if we take a Western population and put them on that same type of diet or use interventions that feed bacteria, that they will become healthy? Turns out there is some data showing that. But again, back to my earlier point, for many people, especially people with pre-existing digestive imbalances, that approach may actually make them worse. And so that's where some of the confusion comes from.
Right. And I think that one of the things that you pointed out too is that this quote unquote healthy bacteria, from the way I see it, and maybe you have a much more specific knowledge than I do, that we don't even really know what what spectrum of bacteria is really healthy for what population. Like you said, we can take certain populations and say, this strain is good in this amount with this other bacteria, and these commensal bacteria are beneficial for these things. What is your point of view on diversity of the microbiota, and do we all need the same strain? Is it simple as that, or is this much more complex than people think?
Oh, you're absolutely right. So it's not as easy as saying good or bad. There are certain organisms, and I discussed in the book, Prevotella corpori 1825, I believe is a designation. That particular bacteria can be harmful or helpful depending on the different context of a human being that it presents in. And we also know that for some people, a given bacteria or given group of bacteria may pose a problem or may pose no problem at all. And something like H. pylori or Blastocystis hominins both have documentation that can support that. It can kind of go either way. So it's not as easy as saying is something good or bad, which further complicates things because we tend to think in absolutes, right? Either it's good or it's bad, and it has to be this dichotomy. But one person may do better on a diet that feeds bacteria, whereas another person may do better on a diet that slightly starves bacteria, because it's not all about the bacteria. What other factors may be important here are the other organisms in the system, and also, and commonly overlooked, is how someone's immune system gets along with that bacteria. And this is where I think the big miss has been made. It's assuming that more bacteria is always better. But for some people, especially Westerners, whose immune systems have not been highly trained through more of a normal, non-hygienic upbringing that we would have experienced if we lived, for example, in a hunter-gatherer band, their immune system tends to be overactive. And so there may be this constant tense relationship between the bacteria in the gut, and then on the other side of that thin lining of the gut membrane, the immune system, there may be this tense relationship. And in some cases, if you feed the bacteria too much, the immune system doesn't like that, and it starts to kick off inflammation and cause leaky gut and cause symptoms in the patient. And so you're absolutely right. It's not as simple as good or bad or more or less. There are, fortunately, some things one can do to determine what they need to do for their own individual gut. And the analogy I use in the book is there are different gut environments, just like there are different geographic environments. So if we were to go to a rainforest and say, wow, it's so beautiful here, there's so many flowers and trees and what have you, look at all the rain. This rainforest couldn't exist without this rain. Therefore, every environment on Earth should have a rainforest level of rain. That would be a silly assumption, right? Because if we took that amount of rain and brought that abruptly into Southern California, we'd have mudslides and people would die. The same thing happens in the gut. Not every gut ecosystem is the same, and not every gut ecosystem requires the same amount of rain, or analogous to rain, we could say fiber, carbohydrate, and prebiotics.
Got it. And so this is the thing, too, where I think that it's very confusing right now to make healthy choices if you don't have an advanced degree and spend your life looking into this type of stuff. Whereas, for instance, this thing we were just talking about diversity of gut bacteria. Someone will tweet a link now that says, well, eating this single food there's a study that shows it decreases this bacteria. Therefore, it's bad. We have the simplification that rightfully we need to make with people that aren't so deep in the weeds in this stuff. And the fact is that more is not better with gut health. And I think that that's something that you kind of shout a lot in your book, which is tremendous, that it's more than just more fiber and more diversity. And I think that a lot of stuff too is just the difference between how it actually works. Like you said, does the immune system play well with it? There are way more factors than just how many bacteria are in your gut. And so one of the things that I think that you say two different things in the book, which is one, that eating to reduce inflammation is more important than eating to feed your gut bacteria. And I think that this goes hand in hand with a point that I always try to make. Is like eating real food first is so paramount. Even if people are eating stuff where they think like, oh, I need to feed my gut bacteria. And in gut health, it will take care of it because the gut, makes sure that the immune system works well. And then get people eating super inflammatory foods, vegetable oils, all the stuff that we know ruins the gut lining and creates massive inflammation throughout the whole body. Can you just touch a little bit about inflammation being a priority over the food for the gut microbiota?
Yeah, no, it's a fantastic point, and you're totally right on. We know that inflammation changes the environment in the gut, thus harboring unhealthy bacteria. So the more inflamed you are, the more the environment favors the growth of pathogenic or unhealthy bacteria. So said another way, more simply, an unhealthy host, right, an inflamed host, will harbor unhealthy bacteria. A healthy host, a less inflamed host, will harbor healthier bacteria. Think about a garden and soil, right? If you had dying plants, you'd want to improve the health of the soil so you'd have healthier plants growing. And this is one of the key misses in this some aspects of the field, which is thinking that you have to increase the health of the bacteria to increase the health of the host. The health of the host is very, very important in dictating the health of the bacteria. So it kind of flips some of the thinking upside down. And there's a fair amount of evidence supporting this. We know, for example, that exercise predicts how healthy someone's microbiota will be. We also know that when we track groups of individuals who are sedentary and then they start exercising, we see their microbiota become healthier. We also know that cardiorespiratory fitness predicts the health of one's microbiota. We also know that vitamin D, just recently we're starting to see evidence emerging that vitamin D, probably through its anti-inflammatory activity, can improve the gut microbiota. And we also know that and this is probably the most salient to our conversation regarding diet, that a low FODMAP diet, which by definition will be lower in prebiotics and lower in compounds that feed bacteria, actually reduces inflammation, reduces symptoms, reduces histamine, a marker of immune activation, and also helps to improve leaky gut. So there's multifold reasons why we should not indiscriminately try to feed bacteria to try to improve the health of the host, but rather look at what factors will improve the health of the host. And by improving the health of the host, we've created an environment that will harbor healthier bacteria to then grow.
Right. And I think that as that goes hand in hand with obviously making healthy choices, not just in nutrition, but getting more sunshine, not being as stressed, etc. You have another point in there that's pretty similar. That is, I think eating to control blood sugar is more important than eating to feed gut bacteria. Probably very close in principle, but can you touch on that for a second as well?
Yeah, and that's another really interesting one that we see. I think some of the most impressive data was looking at children who are type 1 diabetics, so they cannot make insulin. And they showed that after giving them insulin, so after replacing a hormone that their body should be making, so you could say it's a natural treatment because we're just putting back in a hormone that unfortunately type 1 diabetics can't make. They see their blood sugar levels improve, of course, but they also see healthier microbiotas. So blood sugar is something that also factors into this. And we know, as another example, that blood sugar, if it's too high, can be damaging. It can be inflammatory. And this is why you see nerve damage in end-stage type 2 diabetics who have chronically high blood sugar, because it is inflammatory. Also, we know in those same diabetics, they oftentimes have lots of digestive problems because there may be damage to the nervous system in the gut that regulates gut function. So blood sugar is another aspect, just like stress and inflammation, that contributes to a healthy host. And by improving the health of the host, you create an environment that harbors healthier bacteria growing.
Interesting. So your point on the type 1 diabetics as children getting insulin and having improvement in gut health, have you seen any studies that have yet to target someone switching, maybe has metabolic dysfunction and they switch into something like a low-carb ketogenic diet, and their response either positive or negative with their gut health and markers?
Well, so here it gets a little bit harder to answer the question, because we can track something like diversity, but we're still unclear in terms of if diversity is predictive of someone's health, or what exactly we can define diversity as. And I should maybe clarify for the audience, when we hear something like increase or decrease diversity, it's not a simple calculation. You literally have to have an advanced computer program that is crunching hundreds and hundreds of pieces of data to try to determine if diversity have changed, because there's 1,000 some odd species of bacteria in the gut, and it's difficult to say, well, what is considered a significant shift in each one of these individual bacterial populations, and what is normal and what is abnormal, and what is considered a shift that would be considered a shift other than what could happen just from day to day, because the microbiota is constantly in flux. So to say diversity has changed, it's not that simple. You're looking at a ton of data going into a computer program and printing out a report. So sometimes we throw around these terms flippantly, thinking that it's an easy thing to quantify. But right now there's a challenge in research, which is trying to standardize some of this stuff because it's so complicated, it's hard to replicate. And so part of this is difficult to answer, but what I can tell you is there have been some studies that have attempted to answer this, and they've looked at overweight individuals, and they've essentially shown that the lower your carbohydrate intake, the better the weight loss was in the subjects. And they did show when they got to a very low carbohydrate diet, that's when there seemed to be a significant impact on the microbiota. However, whether or not that means anything clinically is hard to determine. And here's an important aspect to factor into this. For some people, starving bacteria may actually lead to a metabolic benefit, because part of what bacteria do is help to harvest more calories from food. And there's a good example about this I discuss in the book, which are the Hadza hunter-gatherers. And this is a group of semi-agrarian, semi-hunter-gatherers. Agrarian means farming. So they're kind of this mix between farming and hunter-gatherers, but they live a very primitive lifestyle in Africa. They consume half the calories of a typical Westerner, and they're far more active. They're literally living in the dirt. And they have a very high colonization of a bacteria. Technically, it's not a bacteria, but it's like a bacteria known as Methanobrevibacter smithii. And this is actually a healthy adaptation for them, because this Methanobrevibacter smithii organism slows down how quickly food moves through the intestinal tract, thus helping one extract the maximum amount of calories out of that food. Okay, so now we take observations from Westerners. What happens in Westerners who are not living the same lifestyle and don't have the same guts as the Africans, but have a high level of this Methanobrevibacter smithii? They have constipation, and they tend to be overweight. So a high fiber diet in Africa for people in that context of eating lots of fiber, of eating less calories and being very active, actually works in the context of their gut. But when we see high levels of that bacteria in the West, it's actually pathogenic and harmful. So the point I'm driving at is it's not always as simple as saying, well, they had less bacteria because they ate a low carbohydrate diet. Less bacteria is bad for you, and so therefore you shouldn't do it. If we see healthy changes in the host, then that might be a favorable adaptation. What may be happening in some of these Westerners is they may have an overgrowth of bacteria, and they may actually benefit from eating in such a way that reduces some of the colonization in their gut, because it can lead to a metabolic benefit. And we do have some evidence to support that posit. There have been a few trials showing in subjects with bacterial overgrowth, defined as small intestinal bacterial overgrowth, administration of antibiotics actually improved their cholesterol and their blood sugar levels. So it's not quite as simple as saying more or less bacteria is good or bad. There's contextual pieces that are very important to factor into the conversation.
Okay, so I think this is a good point to pause and just chat about. I mean, what I saw, you have way more clinical experience than I do, so I want to hear your experience on this. But when anybody came to me with a gut problem, most of the time I would notice that they had an overgrowth of bacteria and not an undergrowth of bacteria. And so can we just break down, and I don't know what your incidence is on this, but can we just break down what that is, and then how that differs as far as the anatomy of the gut between small intestine and large intestine, and maybe even some of the stomach?
Sure. So just as a quick anatomy recap, you essentially have a few components to the gut. You have your mouth, you have your stomach, you have your small intestine, and you have your large intestine. And predominantly where the relevant imbalances occur are mostly in the large intestine and in the small intestine, probably mostly in the small intestine. Some can occur in the stomach, some can occur in the mouth, yes, but the large and small intestine are probably the most important. And of those two, the small intestine is probably the most important. That's where you have the highest density of immune cells in the entire body. The small intestine is responsible for 90% of caloric absorption. It represents over 56% of your digestive tract, and it's most prone to formation of leaky gut. So the small intestine is very important. Another reason for some of the confusion in terms of, it's good to feed your gut bacteria is because of observations made actually in the colon or the large intestine. So another reason, back to our earlier conversation about why so much confusion, we're taking colonic samples, so samples of stool that tell us what's going on in the large intestine, and making an inference that that's the results we're seeing from the large intestine should be extrapolated to recommendations for someone's diet, but they're negating the impact on the small intestine. And the small intestine is where oftentimes, again, it's the most important anatomical region. Not to say the others are not important, but relatively it's probably the most important. And the predilection toward small intestinal bacterial overgrowth changes the game in terms of how to eat. And this is why, to your point, it's common or relatively more common to see patients who have digestive maladies have some type of overgrowth in the intestines. And this might be due to poor immune system programming, amongst other reasons. But said simply, for people who have something like irritable bowel syndrome, IBS, that's a predominantly small intestinal issue, arguably, but predominantly it's a small intestinal issue. And oftentimes these patients clearly, based upon numerous clinical trials, will do better on a lower FODMAP diet that's lower in prebiotics. Now, yes, the first step, and most nutritional bodies like the British Dietetic Association, and I believe also the AGA, recommend first dietarily start with basics. Right? Get off processed food, soda, added sugar. That's step one. If that doesn't resolve someone's IBS, one of the next things to consider is a low FODMAP diet, which will deprive the body of foods that feed bacteria, which probably has the most impact on the small intestine where some of these overgrowths can occur. We also know that fungus can overgrow in the small intestine. So it's not all about being antibacterial, but this is an important aspect of gut health that's been left out of the conversation. Some people do reduce bacteria, or at least reduce bacteria in the short term, and then try to build things back up in the longer term.
What did you say, like percentage of patients that come to you with any type of issues stemming from the gut are from an overgrowth or dysfunction in the small intestine? Hypothesize.
Well, we do have some literature that partially answers this question. And I think it's about, according to the research literature, about 45% of patients, I may be slightly off in that quotation, but about 45% of patients, when you summarize all the data who have irritable bowel syndrome, have been shown to have small intestinal bacterial overgrowth. But that does not include other things that can accompany this, like parasitic infections. Those are actually fairly uncommon, but they do happen. And there is some published literature that suggests that you should screen someone for a parasite when they have gut symptoms, and also small intestinal fungal overgrowth. Another way you could describe this would be akin to using the term candida, which can occur in the small intestine or large intestine, but it's another overgrowth of the stuff that should be there, because fungus is many species of fungus are a normal and natural resident of the gut.
Got it. And so the FODMAP issue that you're talking about here, can you just break that down for people who don't understand what that acronym is?
Sure. So FODMAP stands for fermentable oligomonosaccharides, so different forms of carbohydrates, and polyols. And essentially all that means is these high FODMAP foods are foods high in compounds that feed gut bacteria, also known as prebiotics. So a high FODMAP diet will be very powerful in feeding gut bacteria, and a low FODMAP diet will essentially starve gut bacteria. And the paradoxical thing about the low FODMAP diet is you're reducing foods that are stereotypically labeled as healthy: broccoli, cauliflower, asparagus, avocado. And for some people, they go on a healthier diet, like a paleo type diet that has lots of vegetables, and they feel worse. And it may be because they're now eating more FODMAPs, but they have a gut that's somewhat FODMAP intolerant. And so they're on the surface, they look like they're eating foods that should be healthier for you, but for them, they may need to modify their diet. So they're focusing on the vegetables and the fruits that are lower in FODMAPs. And there's an impressive number of clinical trials showing clear benefit with the low FODMAP diet.
Right. And so this is one of the hypotheses that I have so I've been toying around, obviously, in the last couple of years a lot with ketogenic diet, and then more recently in a carnivore diet. And I've noticed that a lot of people, respond okay to a ketogenic diet, but when they switch to a carnivorous diet, their results just go through the roof. And we were chatting a little bit before the show about your thoughts on this, but even going through and looking at your book, there were so many reasons where I was like, very clearly this is why. Like, a lot of people on a ketogenic diet love avocados, for instance. They're overall decreasing their fiber intake and probably decreasing FODMAPs as a whole, going from, let's say, a standard American diet or even a paleo diet to a ketogenic diet, which, again, I would say not to really worry about for most people, but they're still retaining a lot of that FODMAP containing foods in their diet. And then when they go from that to a carnivorous diet, they have zero. And I think that what happens is a lot of people almost get this transient gut reset from switching to a carnivorous diet because they pull out all of the fiber and anything that would feed gut microbiome. There's obviously some like proteoglycans and stuff like that in cartilage and in meat where you can feed some of the gut bacteria, so you're not getting zero fiber. But I think that doing that is one of the ways that people have such a good response to a carnivore diet is by just removing all the fiber and going super low fiber and basically starving off any type of bacterial overgrowth that they may have. Any thoughts on this as far as, you said you chatted with the Mind Pup guys recently about your thoughts on why a carnivore diet might be good?
Yeah, I think you just gave a very eloquent encapsulation where there are compounds in vegetables and fruits that can be problematic to the gut. And so one way to address that is just to cut out that food group completely, all vegetables and all fruit, just cut those out completely. I wouldn't say that would be the healthiest way to go, and I'm open to any data on this, but if you look at the anthropological data, the best evidence I know of is a review paper by Boyd Eaton and Lauren Cordain, and they showed that over 50% of worldwide hunter-gatherer populations obtain the majority of their calories from animal foods, but it's about 60% of their calories. So even at best, we know that people are going to be consuming almost half, but a little less of their calories from non-animal products, mostly fruits and vegetables and nuts and seeds and maybe beans and maybe a little bit of grain. So, I don't see the evolutionary plausibility. And again, I am perfectly open if someone were to show me data here to support otherwise, but I'd be very suspicious that people are kind of selectively cherry picking. I don't want to say data. I don't think there's any published data to support this, but people are just trying to turn the argument in their favor that we don't need vegetables or fruits or what have you. And I'm certainly not the guy, as you can probably tell, to make a case that you need abundant amounts of those foods in your diet, but to say that you don't need any would be ignoring what the best evidence we have to answer this question says. So one way you could remove the noxious compounds that are in some fruits and vegetables is just by avoiding all of them. If you have a little bit more information in terms of what the problematic foods are, then you can just avoid the foods that are problematic. And I would say in descending order, so starting with the most commonly problematic to the least commonly problematic, you have foods that are high in fiber foods that are high in FODMAPs. So you could start with the low FODMAP diet. Second to that, probably rough, unprocessed vegetable and fruit fibers can be problematic. And a simple way around that is just steaming and sauteing your food so they're not as raw and as rough. Next to that could be cutting out high histamine foods, which is not exclusive to vegetables, but could be helpful for some people. And then the final component, which is less common, but I think for you would see a decent prevalence of this in a population of people who had to go on a carnivore diet, is people who are sulfur sensitive. And this is something I actually had a personal experience with. Many of the foods we gravitate towards, especially in, I guess, a ketogenic and or paleo type diet community, are foods that are high in sulfur. And there's some overlap here with FODMAP, but there's also some nuances. So kale, cauliflower, Swiss chard, asparagus, broccoli, these are all high sulfur vegetables. And if you're eating too much of these vegetables, you can exceed your body's ability to process and drain sulfur if you have a predilection toward not being super robust at processing these. Like some people aren't good at processing carbs and they gain weight easily. Other people aren't very proficient at processing sulfur. It's not a problem. It's only problematic if you're eating one or maybe even two high sulfur vegetables at every meal. And this is something that we've discussed on the podcast recently, and this was helpful for me. I was eating lots of high sulfur vegetables, and I was having brain fog and irritability, and even in some cases joint pain, which are all documented symptoms of sulfur sensitivity. And as soon as I reduced my vegetable intake, I actually felt a lot better. So I understand where some of this comes from. But fortunately, what I was able to do is say, okay, I just need to be mindful of what high sulfur fruits and vegetables are and just not overconsume those. And what's nice about this is I don't have to go to a crazy dietary extreme where I'm never having any vegetables. I can use knowledge to help me craft a diet that's the broadest diet possible for me, but also understand some nuances of, okay, I don't want to sit down and have a piece of salmon and a huge serving of asparagus and a huge serving of cauliflower and make that what I eat on Tuesday because I cooked a big batch of it. Because if I do that, I will have brain fog and irritability that day, and I'll have joint pain the following day. So I think the carnivore diet, as you said, could be used as kind of a cleanse, but I think we can do better than that if we understand some of the nuances of where and what problematic fruits and vegetables to be aware of.
Yeah, I think we could go on and on about this for a while, as I have some thoughts on why it would be good to remove temporarily for more reasons than just gut health, and about nutrient intake in what is necessary from plants versus what is necessary from animal products. And I'll be probably releasing a full podcast on just diving deep on this stuff. So I don't want to hijack another episode with carnivore stuff. I'm sure people are getting sick of it. But yeah, I think that.
Well, Anthony, there's one thing that's just shot in my head. I just want to make sure to throw this in. There's also lectins. I'm sure people have heard of lectins. If someone goes on an autoimmune paleo diet, you'll most likely reduce your lectin load. So if you've done a trial on the autoimmune paleo diet, you've probably also gone low lectin. One other outlier is oxalates, and I don't find that to be as common. But what may be able to help people predict if they are oxalate sensitive is a 24-hour urinary oxalate test. And if you come back just a little bit elevated, meaning you're 10, 20 points over the cutoff, may not be a problem. But if you're much north of that, then you may also want to go on a low oxalate diet. And why this is relevant is a low FODMAP diet, you'll see response within 1 to 2 weeks. A low histamine diet, you'll see a response within a week. A low sulfur diet, you'll see a response within a week. A low lectin diet, likely the same. But a low oxalate diet may be helpful to have a predictive marker to run, because it may be a couple months until one notices improvement from a low oxalate diet. And so that's where having some kind of predictive marker to tell you, boy, should I do this in blind faith for 2 months until I should expect to see an improvement, it can be helpful in those cases to help kind of steer the ship.
Interesting. That's a good point. And I think that so you made a point of yes, it is an extreme diet by all accounts of what people normally eat. However, when there's FODMAP and lectins and sulfur and oxalates and salicylates and in countless things that people could react to in autoimmune paleo and all this different stuff, it's sometimes for people just removing all of that and stop thinking about I need a grocery list of like, this
sure.
week I'm going to try this and this week I'm going to try that. I can get a little orthorexic about it, I think. And having a simple rule sheet of saying, is it an animal? Yes or no. And I'll eat it. Yes or no. Like that is just super simple and super easy. And I agree with you 100% that I don't think the best thing is only animal products 100% of the time for the rest of your life. I think that some people have shown anecdotally that they respond best to that if they have an aggressive medical condition. However, I for sure agree that there is room for incorporating plants into the equation. I don't think that people should eliminate them entirely. But yeah, I think that it can be a super. This is where I think the ketogenic diet goes astray as well, and it becomes very complicated and very confusing for people. Of will this kick me out of ketosis or will this keep me in? And what should my levels be at? Should I do fat bombs or should I do fasting? And all this crazy stuff that's just completely unnecessary. And when it's just eat one thing at a time. Have one steak and that's it. It simplifies things so much for people that I think that there's some usage there. But again, we could go on forever about this type of stuff. One of the things that you said earlier that I wanted to dig into a little bit was that you found your illness initially through a test that screened for parasites. I know that you've kind of the functional medicine scene in general is a little crazy because so many people go overboard with testing, and so they go to a functional medicine doctor and spend $5,000 in testing and don't find anything. What is your approach currently, or your advice to people when maybe they see someone for functional medicine, or just testing in general of if it's accurate or if it's not accurate? What tests do you use typically, and how much could somebody maybe expect from a clinician who doesn't overorder? Any opinion on this?
Yes, I think this is one of the areas that the healthcare consumer has to be the most cautious. And I don't think any of the practitioners are, trying to be malevolent in any way. I think it's a educational problem that stems from the top of the field and has trickled its way down. So I think any provider or most providers and practitioners, if they are testing a lot, are not doing it because they have any financial, incentive or what have you. I think they're doing it because they think it's the best way to help their patient. But the field is growing, the field is advancing, the science is progressing, and part of an advancement is increase efficiency. And so just like your cell phone now is half the size and can do 10 times more stuff than your cell phone could 10 years ago, with functional medicine, as we're becoming more skilled, we can do more with less testing. So it's a change that's occurring in the field, but the whole field isn't yet on the same page with this. But you do have to be careful. Now, I would say for most people, an initial lab bill of a couple $100 to maybe $1,200 would be reasonable. This would allow someone to do anywhere from 1 to maybe 3 tests out of the gate. So a SIBO breath test is about $200, a stool test and anywhere from maybe $300 to $400, and then maybe you want to do a blood panel to look at some things like cholesterol, vitamin D, screen for anemias, look at someone's thyroid, and that might be another $200, right? So, and that's if there's no insurance coverage, of course. So that's reasonable in my mind. Are there rare exceptions to that? Yes, but that's a reasonable place to start. And that's a reasonable cost. If someone's being confronted with a initial lab bill of $3,000, $4,000, $5,000, $6,000, then again, I don't attribute that to any ill will on the clinician's part, but they're probably operating in a model of functional medicine that's utilizing testing excessively. And the real travesty is that I shouldn't say a lot, but a fair amount of the testing done in functional medicine is not useful. Just to bottom line it, a lot of the testing is not useful, has not been validated, and it's attempting to help people. But unfortunately, too much testing will add variables to the equation that makes it harder to solve the problem, especially if the variable you're adding is what I call a meaningless measure. If you're using an unvalidated test that has not been shown to have the ability to aid in treatment, but you're treating that marker, you are treating something that's useless. And just as an example, there was recently litigation brought against one urinary neurotransmitter testing company, and they actually pled guilty to fraudulence because they were essentially manipulating the lab values of their tests. So all of the clinicians who were using that testing for years and years and years were actually treating something that meant almost nothing. And so all those patients thought they were diagnosed with whatever it was, and that the supplements they were taking was helping that diagnosis, but it turned out that it was a bunch of smoke and mirrors. So just because you see a high or a low on a test does not mean that actually means anything. You have to be very careful with this because it's a very fast way to squander resources. So testing, in my mind, is very much so overrated, and it's taken me 8 years to be comfortable saying this. And I really had to struggle with some internal dissonance that is so pervasive in the field that really indoctrinates you into thinking you must test, right? If we're not assessing, we're guessing, as it's sometimes portrayed. And certainly a degree of testing can be helpful, but so much of the testing is really not needed. And especially in the gut work. And in the whole self-help protocol I lay out in my book does not require testing. And we've had people singing testimonials from all over the world who have been hugely helped, even patients who have seen other doctors and the doctor has not been able to help them. We've been able to help them with an approach that requires no testing, because if you understand this topic well enough, you don't really need much testing. There are simple algorithmic steps you can take based upon your symptoms and your responses that can lead you to where to go. So it's really important that people understand that. And just as an example, okay, you think you have something that's causing your gut problems. And maybe I should make a quick tangent because we didn't touch on this yet. You can have a gut problem that manifests solely as non-gut symptoms. So you could have a problem in your gut and your only symptoms are brain fog and insomnia, or fatigue and depression, or skin rashes and mental fog. That is very much so possible, and the published research is starting to prove this more and more with every passing few months. So it's important to keep that in mind. But let's say you have insomnia and you have some fatigue. That may be driven by a gut problem. You're saying, I want to find out what it is that's causing this. If you came back with H. pylori, small intestinal bacterial overgrowth, candida, toxoplasmosis, any of those, they can all be treated with the same herbal protocol. So, what does the testing do? That herbal protocol can be given to you if you fail out of the frontline therapies, 1, diet, and then 2, other general but targeted gut supports like probiotics, which are step 1 and step 2 in my book protocol. If you fail out of those, you haven't been able to rectify the presumed dysbiosis or imbalance in your gut with foundational therapies. So the next escalation would be an herbal antimicrobial protocol that will give your microbiota a nudge. And it's not about custom forcing the microbiota to do what you want, but it's kind of giving this little bit of a nudge to the microbiota so that the guys that have overgrown and are not allowing the other players to feed and grow can be kind of swept out. And you disrupt the colony a little bit so that a healthier equilibrium can be achieved. And so there are multifold different imbalances in the gut that can all be treated with the same protocol. So testing really contributes very little. Now, that being said, I do use testing in the clinic. Many of my patients want it. They feel better about having it. I feel better about having some documentation. But oftentimes I go through the same sequence of treatment steps irrespective of what the labs show. And this is why I'm doing less testing today than I was doing a few years ago. So I'm sorry to be a little bit long-winded there. In terms of the testing that I run, I kind of alluded to this a moment ago. Depending on the case, a SIBO breath test is something that's justifiable. A stool or potentially a stool, blood, and breath test that will look for things like parasites and other predominantly colonic dysbiosis. So this is many of your kind of like take-home stool tests. It can be helpful. And then in addition to that, looking at a blood chemistry to screen for things like low vitamin D, blood sugar problems, anemias, looking at someone's thyroid. Oftentimes your conventional doctor will be looking at some of these things, but there are some nuance items that a functional or integrative doctor may want to look at also and may be able to contribute to and help. And again, that should cost you anywhere from a couple $100 to maybe $1,200 as a reasonable starting bill.
Right. And I think you make a lot of good points there. So thank you for being long-winded. One of the philosophies that I used when I was in practice was, does this test have any potential to change the outcome of the treatment plan?
Exactly.
Will this change the treatment plan? Yes or no? And so people would want, for instance, let's say they're dealing with low back pain and they want an MRI to see if they have a disc bulge or herniation or anything like that. Well, the answer is no, because the treatment plan is not going to change. Either way, we're going to treat flexion intolerant low back pain the same exact way, if you have a disc or not. And so it's, if you're not responding, or if there's other things that are coming into the fold that maybe would alter that, then obviously we would get imaging to see if the treatment plan would be altered after that.
Yeah.
I really appreciate your approach, because there's so many times where people, I promote functional medicine a lot, and then someone goes to see someone and they say, oh, well, they ordered $5,000 worth of testing and I don't know what's going on still. Or now I'm on 15 different type of treatment plans that are all conflicting with one another.
I say my clinic probably gets 1 to 2 emails a month with someone thanking us for helping them realize that a $5,000 lab bill is not normal. And so it's not a uncommon problem, unfortunately. It's something that happens fairly readily. And again, for the clinician who might be doing that, it's not a knock on the clinician. I think the clinicians are doing the best they can with the information that they have. I think the education needs to be updated to help us be more discerning with the testing that we're using.
I agree. And one of the things that you said in your book, and I'm paraphrasing here, but it's something like, when I stopped treating the patient's adrenal profile and started treating the actual patient, my outcomes were way better.
Yeah. It's same sort of thing there. And that was one of the first tests I stopped doing, because I really did not find it to be useful. And I remember one of my classmates back when I was doing my internship, this guy could deadlift 400 pounds off the floor, was super vital. And we did an adrenal profile on him, and he looked like someone who should be in the hospital. And I'm saying to myself, gosh, then, there'd be another gal who came in my internship, one of the patients I was treating in the outpatient clinic there, who was very, very ill, and their adrenal profile looked normal. And I'm saying to myself, what am I missing? And you're kind of doubt yourself, like, am I that dumb where like this isn't making sense to me, but everyone else around me is doing it? And I figured out that no, like, I think most people have a hard time questioning authority and questioning their training, and so they just kind of keep doing what they're told to do. Fast forward now, 8 years later, a systematic review was recently published that looked at about 60 studies on adrenal fatigue testing of all different methods of adrenal testing, many very high quality methods and methods that are often used in clinical functional medicine practice. And they found that over 50% of the time, the test results did not match someone's fatigue scores. So if you have a test that is inaccurate and unrepresentative of the patient over 50% of the time, how helpful is that going to be? Not to mention that in all these trials we have using herbal medicines for adrenal fatigue, in no study except for one did they use the testing to determine how to treat the patient. It was usually, you're tired, here's some ashwagandha. They come back a month later, I feel better. That was it. So the testing is nice in theory, but when you're using a marker that has no relevance to the real world, and you're talking about $200 a pop, and your practitioner wants you to retest it every 2 to 3 months, that's a lot of money that you're going to utilize right there.
Right. And speaking of using money unnecessarily, I think that every person in the world right now, or at least in the United States, thinks that they need to have 15 different probiotics. Does everybody need to be taking probiotics? Does it matter what strain? Is it just a thing that people should generally do prophylactically? Your thoughts on purchasing and consuming probiotics?
Sure. Well, there's a lot of exciting research showing the benefit of probiotics. We know, for example, that probiotics, to come back to the connection between the gut and the brain from earlier, we have one meta-analysis, and a meta-analysis is a summary of all the available clinical trials. So this is very high-level, summative scientific evidence that has shown that probiotics can aid in both depression and anxiety. We have other studies showing that probiotics can help to slightly reduce cholesterol, blood sugar, and blood pressure. The effect is slight, but it's still been documented. We have impressive data showing that probiotics can help with the symptoms of IBS, bloating, abdominal pain, altered bowel function, so constipation or diarrhea. We know that probiotics can be anti-SIBO, small intestinal bacterial overgrowth, anti-candidal, antifungal, antiprotozoal. Other evidence suggests that probiotics may help with periodontitis or disease of the gums or the bones that underlie the gums. We have other evidence showing that probiotics may help with inflammation systemically. There was recently a systematic review published showing that probiotics and fish oil, each separately, can help to lower C-reactive protein and I believe also interleukin-6. So probiotics, and that's just some of the benefit. Probiotics have multifold benefit, but there's also a lot of confusion around probiotics. And there are probably now hundreds of probiotic products. One of the things I discuss in the book is that when you look at the clinical research on probiotics, you can really organize probiotics into probably 4 categories, but 3 that are only really relevant for our discussion. So if you look at all the trials on probiotics, you can classify every probiotic used as either a category 1, 2, or 3. A category 1 is a mixture of lactobacillus and bifidobacterium species. So when you look on the label, you'll see lactobacillus acidophilus, bifidobacterium infantis, what have you. And you'll see maybe 10 different lactobacillus and bifidobacterium strains on there predominantly. There may be 1 or 2 things that are non-lactobacillus or bifidobacterium, but you're looking at predominantly lactobacillus and bifidobacterium. Category 2, a healthy fungus, Saccharomyces boulardii. That's what you'll see on the label there. And then category 3 are soil-based or spore-forming probiotics, and you'll see a few different bacillus strains, Bacillus subtilis, Bacillus coagulans, Bacillus licheniformis. So you'll see a couple different bacillus strains. So all of the hundreds of products, for the most part, can be organized as either category 1, category 2, or category 3. Why this is helpful is because it can help you determine what type of probiotic to use. Most people will feel a little bit better on any one or all 3 of those probiotics. But occasionally someone may notice this probiotic made me a little bit bloated or made me feel a little bit constipated or made my stools kind of loose. So instead of trying all these different products and unknowingly you're trying the same category, right? So you go out, you try Gut Cure 5 and it's a category 1 probiotic. It gives you bloating. You say, oh man, but I really need a probiotic. So you go out and you try, Bifido Blend 2000 and you try that. And again, you have bloating. You didn't realize that you're taking another iteration of the same thing. So if you can figure out these categories, you can determine category 1, how do I respond? Category 2, how do I respond? Category 3, how do I respond? And get off the merry-go-round of trying the litany of probiotics that are just various reiterations of the same category of a probiotic.
Got it. And so do you think that people should go through maybe that testing and see how they respond to those? And if they have either a net neutral or net positive effect, they should just continually be on those? Or what is your thought process there?
So we also talk about this in the book because probiotics aren't the only thing I'd recommend for someone's gut health. So I'm kind of giving an answer in isolation, but that should be used as part of a broader gut healing program. But I would use the probiotics that you notice neutral or benefit from, and I'd use them for a number of months until you feel like you've plateaued in terms of your improvement. Once your improvement has plateaued, and this is a general philosophy I think applies to most treatments, once your improvement has plateaued and you've been stable in that plateau for 1 to 2 months, then try to wean off. And what you may notice is when you wean off completely, you regress. So go back on a small dose and see if you can find the minimal effective dose to maintain the improvements. Now, you could make a case for long-term administration of probiotics. I think we have some data that could support that, but I'm a minimalist, and I think the best approach is trying to find the minimum number of dietary restrictions and the minimum number of supplements needed in the long term. So what this may look like for some people, they feel great on probiotics for 6 months, they ride the wave, and then later they try to wean off and they notice they generally feel better when they're on probiotics than when they're off. but they may be okay with dosing their probiotics 3 days a week instead of dosing probiotics 7 days a week.
What about
and that's what they do.
What about somebody who just doesn't, they're not looking to improve any health markers, they just think that they need to have that every day in their little supplement stack?
Again, I think you can make a case for it because we have a number of studies showing health benefit. I would like to see someone, if they can, try to get an increased consumption of probiotic foods. So drink a kombucha, have some kimchi, use some sauerkraut, have some kefir. I think that is a good way to start and probably a good foundation. But I would have no quarrels if someone wanted to add it. I know of no data showing that they would be detrimental. The only thing that I've seen, and there is some evidence to support this published, is that people, the most common adverse reaction, although rarely reported, is bloating. And so if someone has bloating, they may be overdoing it. It may not mean they have to stop probiotics completely, but they may just be overdoing it. And if they back off on that dose slightly, then they may be fine.
Got it. And one of the things that I recommend to people in this regard, and correct me if you think that there's a better way to approach it, but like you said, there's, if you take it, an adverse response, then feel free. It's probably going to be, either net neutral or a net positive. Who knows? However, if they're sacrificing for they're buying $200 worth of probiotics per month and not buying real food because of that, I think that's kind of a ridiculous way to look at it. Like if people can afford it and it's not going to impact any other quality of life for them, then I think that sure, there's no harm in it. But I see so many people that sometimes think that the magic pills is going to save them, not, for instance, eating real food or not being stressed about money is probably more important than having the probiotic that for them probably doesn't change much from a day-to-day basis. Totally
agree. And that's why in the book protocol, we start off with the foundational factors, which are really diet and lifestyle. Those are your foundations. Those are the most important. That's what, if you have a limited ability to allocate resources, time, effort, and energy, you should really focus on the foundation of the pyramid, which is diet and lifestyle.
Got it. And so you said that there were 3 categories of the probiotics. How does probiotic food differ in that way? Are they at one of the class or not, or is it just completely different conversation?
It varies a little bit from food to food, and I can't profess to know the probiotic breakdown on every fermented food, but you tend to see an assortment of the 3 categories blended into one. It's a little bit less common, I believe, to see the category 3, the spore-forming probiotics in a fermented food. I may be slightly off in that because there may be a couple, but I think you're going to get predominantly category 1 and category 2, maybe a little bit of category 3, although some food manufacturers are starting to put category 3 into foods because category 3 probiotics are heat stable, and it doesn't matter if they're exposed to heat or to acid or what have you, they tend to survive.
Got it. And so one of the things that you touched on, I know you probably have to wrap up soon, but your assessment protocol and how you guide people through at the end of your book is, in my opinion, phenomenal. Like you mentioned, I think that a lot of people can do kind of a self-assessment algorithm where they decide where they're at with their symptoms and choose what they're at. And there's no downside to doing that in a lot of these cases. So if you go through that and you fix everything, great. If you go through that and then like stuff is, maybe you're in a rare case where you didn't respond well then yeah, I mean, you might need to have some deeper work done. But I think that the way you have it done is going to be so helpful for so many people. So can you just kind of go through your, was it grade and 8, your protocol that you have at the end of the book a little bit, just kind of an overview, and if people want to learn more, they can obviously pick up the book.
Sure. And just to help people prevent getting caught up in any confusion regarding the names, the name of the book is Healthy Gut, Healthy You, and the name of the self-help plan at the end of the book is called The Great and 8. It's 8 steps that are personalizable and adaptable, but not everyone has to go through all 8. So for people with more severe gut impairments, they'll likely need to do all 8. But for people who just need a mild tune-up, they may only need 2 of the 8 steps. And each step essentially walks you through an important aspect of gut health. And at the end of each step, we reassess your symptoms. And based upon your assessment, you either continue to escalate therapies or you go into maintenance mode. And step 1 essentially takes one through diet and lifestyle. And that may sound easy, but you're doing some work. You're going to discover what diet works best for you. Will you be paleo? Will you be autoimmune paleo? Will you be low FODMAP? Will you be low FODMAP plus STD? Do you need to go low histamine? Now, if that sounds like a lot, remember that you're only doing the minimal amount to find what works for you, and then you're moving on. You're not doing all of this. So someone may only need to go low FODMAP, boom, 2 weeks, they feel great, and they move on. Someone else may go paleo, they don't respond, go low FODMAP, they don't respond. They have to go low FODMAP plus SCD and plus restrict their histamine. But the point is that each individual will be served by the dietary step, and you're going to be able to navigate through that, find what works for you, but spend no longer than you need to get to where you're looking to be. But there's also an important aspect here, and we also talk on lifestyle. We lay out guidelines for how much time you should spend in the sun and a few other important things. But not everyone is going to be able to remedy their digestion with diet alone. And this kind of comes back to the carnivore diet. There's almost for certain an imbalance in the gut there that needs to be rectified. And diet alone may not be able to do it. So what people end up doing is they eat an overly restrictive diet in attempts to improve their gut health. And we do see published data that supports this approach. There was a study performed in Italy, a multi-center study that looked at 12,225 patients who had non-celiac gluten sensitivity. And essentially, they found that these patients who were reactive to gluten, 30% of those patients actually had another underlying issue in the gut that was causing that gluten reactivity. So this is not a airy-fairy left-wing concept. We are seeing documented clinical and published evidence supporting this, that if you have dietary restrictions, there's a probability that those restrictions may be secondary to another imbalance in the gut. So step 2, we escalate therapies where we use some vitamin D, potentially some adrenal support, and then we also help someone find the optimal probiotic protocol for their gut and enzyme protocol for their gut. Then we reevaluate and we move on. And I'm not sure, do you want to go through all the steps, Anthony, or leave it there?
Yeah, I think that's probably good enough so people know that it's very specific in each step. You kind of progress, and I think that sometimes you're like, if you feel like this at this point, skip to step 5, et cetera, et cetera. So it's kind of this like choose your own adventure situation in the back, which is awesome. And so I really appreciate you taking the time to take your clinical experience and codifying it down to this super easy to follow thing that anybody can look at. And then it's just, like you said, you can get the book, you can go through it. So helpful.
Awesome. Well, thank you. Yeah, I mean, it was about 3 years of work, and it truly was a labor of love. I wanted to give someone, like I said at the start of the call, everything that they would need. You're not going to need to go read another blog or listen to another podcast. Everything you need regarding your gut health is contained in the book. I mean, within reason. Of course, there's always going to be exceptions for some people who will need some additional care. But for the vast majority of people, everything you need will be there. There's no BS. There's no dogma. We look at both sides of the issues, and we try to help you come away with the most reasonable and effective recommendations regarding all these different aspects of gut health.
Love it. Well, appreciate your work, Doc. Can you just give people where they can find you from social media and website and everything?
Sure. Yeah, my website is drruscio.com. That's drruscio.com. And my Twitter is, I believe it's drruscio, so drruscio. And I think my Instagram is the same thing. And then Facebook, it's just /drruscio. And if you go to the homepage, you can plug in pretty much everything there, all of our social media. You can click through to learn more information about the book. And of course, we have a weekly article, video, and podcast if people want to plug in and follow us on a weekly basis also.
Awesome. Yeah, I got my book on Kindle version on Amazon, so obviously on Amazon as well.
Yeah, and the book is available on Amazon and Barnes & Noble, both in paperback and digital form. So yeah, thank you for pointing that out.
Got it. All right. Well, appreciate it, Doc. Always enjoy our chats.
Yeah, me too. Thanks for having me on.
All right, everyone. Thanks for listening to another episode of the Keto Answers podcast. I hope you enjoyed it, but even if you didn't, I would love a review. Just go over to iTunes, wherever you listen to your podcasts, and pop in a review so we can get found by more people, get better guests, and have the information that you need. So please go to iTunes, or wherever you listen to your podcasts, and leave us a review. And if you're new to keto, head on over to perfectketo.com/podcast and enter your email for all our top tips and guides on getting started with the ketogenic diet. Thanks, and we'll see you next time.